Hi guys, good morning, good Monday morning. Hey, listen, what I'd like you to do, if you can, is as you're following along with this is going to be a video, and I'm probably going to do it in a couple of stages because for the final, or not for the final, for the midterm. Hello, crashed and burned on that one. Anyways, this is going to give you. I'm not going to give you questions, till the day I remember. Got 24 hours, okay, to do this. When you get it, when I post it. And I'm probably going to post it maybe, on the night of the 19th. Okay, maybe. Okay. And you got 24 hours then from the time I post it to finish it up. All right. Now I'm assuming you guys will do me a big favor and, you know, for the midterm and the final, um, you know, think about your answers. Okay. And in a multiple choice test, there may be a couple of right answers, but it's the best one that you can choose that is correct. The other thing I want you to think about and do right away if you can, at least within the next week, it would really kind of help us all out, including you, is send an email to Desert Valley. I gave you the site. Just look at the site. Keep up with your emails, keep up with your sites, if you will, because we'll try to post things at least twice a week. And if you have questions on anything, call me, but send Desert Valley an email and tell the staff, okay, tell them your name. You don't have to put your last name, just say my name is Charlotte, okay, or whatever, and say, I want to thank you for your service to us. That really appreciates it. Guys, these guys are worn frazzled. They're down on staff members and stuff like that, and help, extra help. And so it would really help them. It really would. And just tell them the class you're in. My name is Charlotte. I'm in basic arrhythmia at Victor Valley College. I want to thank you for everything. And I gave you that site, okay? So if you can't find it, just give me a call. I may put it on this again, just that I keep forgetting it because my wife knows it by heart. All right. So, anyways, it really helps, guys. It's I'm sure you've heard this a million times over, but it's not just a saying. We are in this together, okay? And we will rise up. All right, we will. So, anyway, the midterm is on May 20th. 24 hours to complete. The final, June 10th, 24 hours to complete. Now, here's one other thing I'm going to do. On your paper, your 3-page type paper, I gave you a couple of films. Remember the Titans? Something the Lord hath made. Okay. And Radio. They all deal with being prejudiced in the medical field. You know what? I'd like you to write about it if you want to for your 3-page type paper, or pick anything in basic arrhythmia and write on that. Have somebody read it. And what I'm going to do is I'm going to come to you somehow over the computer, and I'm going to have you read it to me individually. Okay. And this is at the very end, and I'm going to have you show me your book that I told you to put together individually. So I want a place for notes, want a place for handouts, if you have that. Remember to fill in all the strips. I'm going to have you show me that on computer. I know it's not something I told you before, but since things are changing here daily, what the heck? I thought I could change a little bit. All right, because that would be a good thing. to, make sure that you do it. All right. All right, listen. So all that is not due till the 10th, but you get 10 extra points for writing that letter to Desert Valley Hospital and thanking them. You could also, just another thought, you could also go down to one of the police departments and say, here, this is for you. Okay, and maybe give them a pizza or something like that for their lunch. It would really help. Or maybe one of those gift cards, 3 or 4 of you could go in on it together. Just maintain that social distancing. I don't know if you've heard about in March, there was a birthday party and 5 people came down with it. They weren't practicing social distancing. This is not a joke. Okay, this is not maybe, you take a 1-a-day multiple vitamin, Flintstone to whatever you're to. Okay, and you don't get it. Focus. Stay healthy. Get plenty of rest. Okay? And I don't care what you want to talk about, hopefully something to do with basic arrhythmia, but it doesn't make any difference. Give me a call. I'll listen. All right. So I'm going to give you some areas to study for in your midterm. 100 questions. All right. So here we go. Remember we talked about the anatomy of the heart. We said there's a double-layered sac surrounding the heart, okay, called P-E-R-I, which means surrounding or outer, cardium, C-A-R-D-I-U-M. But the outer layer of this is kind of a tough layer. It's like a piece of plastic, very tough. Okay, and it's called fibrous pericardium. Now the inside is another layer, and it's called serous pericardium. And the serous pericardium, so fibrous pericardium outer layer, serous pericardium middle layer, right? The serous pericardium has 2 sublayers. One is called parietal, P-A-R-I-E-T-A-L, parietal pericardium. The parietal pericardium is kind of like, if you will, hot glue up against the fibrous layer. And then you hit the visceral pericardium is next. And the visceral pericardium is right up against the myocardium. So between the parietal pericardium, glued right up against the fibrous layer, and the visceral pericardium, glued right up against the myocardium, there's a space. And the space is called pericardial space. And somewhere in there, there's about anywhere from 20 to 30 milliliters of fluid called pericardial fluid. So when the heart contracts and expands, it's got room to move a little bit. Have you heard of pericarditis, inflammation? Okay. So then, what do we hit? We hit the myocardium, and the myo means muscle, cardium is heart. That's the mechanical layer. That's the layer that when it gets an electrical impulse, stimulates the myocardium to contract. Okay. Then what do we got? We've got the endocardium. Endo meaning what? Within. Cardium, heart. The endocardium is the very inner layer of the heart. It actually covers the heart valves and so forth. Okay? So we've got these layers. I want you to be familiar with them. I don't know why, but just be familiar with them. And once again, question, don't understand something. There's no such thing as a dumb question. Call me. I don't mind talking to you. All the way up till 8 o'clock at night, let's say. Doesn't make any difference, even on weekends. I want to be here for you. Okay. But if you call me rather than text me, I can probably tag it and bag it a little bit quicker. Maybe I'm misunderstanding what you want. Okay. Then, on the outer layer of the heart, the very, very outer part of the heart, are arteries. and they're called coronary, C-O-R-O-N-A-R-Y, coronary arteries. They feed the heart itself with blood and oxygen. Okay? And they keep it supplied with that blood and oxygen. And it's when those coronary arteries become narrow we call stenotic, real narrow here, yeah. And they get a lot of fat, not that any of us would have that. I'm looking down. A lot of fat, a lot of cholesterol, eggs, red meats, creams, butter, even milk has fat in it. I think I told you. You want some low non-fat milk? Get a big glass of water, drop a couple of drops of whiteout in there. I'm kidding. All right. Hopefully somebody won't do that without adult supervision. All right. So you get the idea. So we're to eat things like turkey, fish, things like that to cut down in our cholesterol, to cut down in our fat. Try to stay healthy and try to get plenty of rest during all this stuff. And try to maybe watch a little bit of news, cut it off. Watch a good picture. All right. At least that's what I'm trying to do. All right. There's your immune system, primarily your white blood cells. Okay, when you look at blood, remember it's viscous, it's thick. That's what the heart pumps. The right side of the heart, here's my right? Anatomical position, person standing erect, palms of the hands facing forward, thumbs out to the side. Yeah, it's not your right and your left, it's my right and my left. Right side of the heart pumps unoxygenated blood back to the lungs. So in those little tiny spaces called alveoli, which are surrounded by a net, capillaries, oxygen and carbon dioxide can take place, can exchange. Okay? So the right side of the heart pumps all this dark blood back to the lungs so it can become reoxygenated. The left side of the heart, my left, pumps oxygenated blood out to all the cells, the tissues, and the organs of the body. The right side of the heart, when pumping unoxygenated blood back to the lungs, is called pulmonary circulation. Pulmono, lung, air, breathing, in this case, lung. The left side of the heart is called systemic, S-Y-S, T-E-M-I-C, systemic circulation. Systemo meaning the body as a whole. Systemic circulation pumps oxygenated blood out. 4 chambers, 2 upper chambers, atrium, 2 bottom chambers, ventricles. Between the right atrium and the right ventricle are valves. And on the right side, okay, the valve between the right ventricle, the right atrium and the right ventricle is called tricuspid. Cusp because it has 3 little flaps on it. Okay, tricuspid. The valve on the left side of the heart between the left atrium and the left ventricle is called bicuspid. It's also referred to, bicuspid is also called mitral valves. So the tricuspid and the bicuspid are referred to in general as AV, atrial ventricular valves. Now that took somebody a long time to come up with, I'm sure, but the AV valves are what? Why are they called that? They're directly between the atrium and the ventricles. The other 2 valves, one of them on the right side, between the right ventricle and an artery that looks T-shaped, it's called pulmonary artery. Okay. And Well, let me go back here a second. Getting myself confused, lack of sleep, whatever. Watch this. So if we go to the right side of the heart, at the top of the right ventricle is a little valve, okay? And this valve, when the right ventricle contracts, this valve called pulmonary valve, okay? It's also called semilunar. Pulmonary valve or semilunar, it's at the top of the right ventricle. So right ventricle contracts, you go through this three-chambered valve called pulmonary, and then blood goes to a T-shaped tube, the pulmonary artery. Okay? On the left side, the valve at the top of the left ventricle is called bicuspid valve. It's also called mitral valve. And when the left ventricle contracts, blood goes up through the mitral valve and goes out through a big arch right off the heart. And it's called aorta. Aorta, out to the rest of the body. Now, I want you to know specifically about how blood flows through the heart. Again, even better than I can do it, because I'm not going to sing it to you. But you remember that little show that came on every week? And the show was Happy Days, okay? And in Happy Days, the Fonz, and they all go to college, and they're taking biology. And the biology teacher says, look, I want you guys to trace blood through the heart on a test. So you know what they did? They made up a song called Pump, Pump, Pump Your Blood. And it's right on. So listen to that. Okay, I don't expect you to sing it. Yeah. But listen to it and get the idea of how blood flows through the heart, both on the right side and the left side. Know the valves. Know the walls. Now, heart attacks, just so you know this in case I forget it, start on the inner layer of the heart, endocardium. And then if they're left untreated, they go all the way through the walls. And going all the way through the walls is called trans, which means through, mural. Mural means wall. Remember the signs and symptoms of a heart attack. Remember the causes. The etiology, big 2-cent word. E-T. I-O-L-O-G-Y. Etiology is the cause. 3 major causes for heart attack, 3 major ones. Hypertension, high blood pressure. Hyper, above, excessive. Tension, pressure. Smoking, stuffing leaves in your mouth, lighting them on fire. You know what that does? It causes blood clots. Also wrecks your lungs, so your blood and oxygen exchange goes way down. Okay? Wrecks those little alveoli. Look, if we could get an alveolar roller pin, yeah, from Stater Brothers, roll all these little bubble-shaped spaces called alveoli flat, it would equal 30% of a basketball court. That's a lot of surface area, but you need that area to exchange blood and oxygen. And anything we do with smoking or, breathing in dangerous chemicals or whatever, we lower that percentage. So hypertension, smoking, and high blood cholesterol are the 3. Now, 3 major causes of having a heart attack. And what do we call a heart attack? Myocardial infarction. Infarction means death to the myocardium, okay? To where those muscle cells don't do a really good job of contracting very much. And then they can be irritated, and they can go into ventricular tachycardia, real fast rates. And then they can go into ventricular fibrillation, where the bottom chambers of the heart are just shaking, no output. And that's time to start that Catholic-Protestant relations, that's CPR on the heart, right? Hard, fast, and deep compressions with little pause, little pause. All right. So if I say, give you an idea of what is the right job function of the right side of the heart, you can say pulmonary circulation, left side, systemic circulation. Okay, we talked about the 3 major risk factors. Also, being a male is a risk factor. Okay? But you know the number 1 cause of death in women today? Because if you would have asked me this 30 years ago, I would have said cancer, ovarian cancer, uterine cancer, cancer. Major cause today is heart attack. Things have changed a little bit. And one of the biggest things that changes, I'm not trying to be funny, but one of the biggest things that have changed is job reversal. Men taking on women's jobs, women taking on men's jobs, and women not only taking their job, but then going out and working on top of that and everything else. Ladies, I think you have the most important job in this world. And I think you work a lot more harder than we do. Just don't tell anybody. I don't want anybody to egg my cart. But that's my real honest opinion. Okay, we talked about if somebody's having a heart attack and they have a lot of chest pain throughout the week, they may have angina pectoris. Angina pectoris. Angina is chest pain. If you don't treat it, it goes on to injury. Injury is where tissue becomes eventually wounded, scarred. And then we go on to infarct, death. But some of these people, because of their chest pain throughout the day, may be taking nitroglycerin, little tiny tablets. Nitro is a vaso, V-A-S-O, which means vessel, dilator. It opens up the coronary arteries. You know when the heart receives its blood? During diastole or rest. So nitro, if a coronary is stenotic, very narrow, blood can hardly get through. Nitro opens them up, lets more blood through. They say you should take a nitro when you feel the pain come on. Usually given a lot of other ways, but sublingually, under, lingual, tongue. And you don't drink water with it or chew it. Okay, you let it dissolve. Sublingual nitroglycerin. If that doesn't go away in 3 to 5 minutes, your pain is still there, take another nitro. If that doesn't go away in 3 to 5 minutes, take a third nitro. Okay, 3 nitroglycerin. Another thing you should take is a baby aspirin. How many? 4 81 milligram aspirin. What are those? They're not blood thinners, but you can call it that, and that would be perfectly fine with me. Why? Everybody calls it a blood thinner. In science, there's theoretically no such thing as a blood thinner, but okay. So blood thinner. Aspirin, low milligram, baby aspirin. St. Joseph's aspirin for children, 81 milligrams. Take 4 of them. Why? They'll prevent clots in the coronaries. Now, if you get a narrowed coronary, sometimes we like rust in a pipe, narrowed, stenotic. We call that sometimes plaque, P-L-A-Q-U-E. If the plaque gets a crack in it, you get an immediate blood clot, a thrombosis. Thrombo, blood, osis, abnormal condition of a blood clot. And so what the aspirin does is it helps prevent the blood clotting because it's a what? Antiplatelet. Now, never give a drug unless you got a doctor's order to do it. You can give up 3 nitroglycerin, but you still have pain. Don't go for more nitroglycerin. Do not do that. Call 911. Do not transport if you can possibly get away with it. Why? You just increase possibilities of things going wrong if you transport. Another thing that I thought was good. They have this little tiny box out now, wearing a lanyard around her neck. You press one button and it dials 911 anywhere. It's a good thing to have. Why? What if you're on the floor and the phone's over somewhere else? What are you going to do? You don't pay any monthly fees for it. If you look at QVC, they have one that's waterproof and they have one that, mostly sunny weather. Know where the heart is positioned. It's positioned between the lungs in a space, right between the lungs. What's the space called? Media, M-E-D-I-A, steinum, S-T-E-I-N, like Nancy, U-M, steinum. Mediastinum, literally translated, means standing in the middle. That's where your heart is, about the size of your fist. Standing in the middle of the lungs. And how's it pointed? Downward and to the left. Downward and to the left, okay? Okay, so angina, caused from what? Ischemia. Remember I. Ischemia. Where do you go next? Injury. Like a wounded or damaged cell. Where do you go next? Infarct. Ischemia, injury, infarct. Do not put this stuff off. One of the biggest symptoms of a heart attack is denial. And people will deny this all the way up to the ER. I told you years ago, one guy, a construction worker in Hesperia, was screaming at the paramedics when they walked across the field. It's not my heart! It was. He had a heart attack right there and died. Ladies, guys are the worst at this. If they don't do what you want them to do, if they don't go in, if they don't make an appointment, pack your bags. This is before COVID. Pack your bags. Get your suitcase. Go, honey, I'm taking our credit card. I'll be in town. I'm going to order all my meals to a really nice hotel. And when you make your appointment, I'll come home. Guess what, ladies? We think we have control. No, we don't. You pulled out once or twice with them. They're going to start being motivated. All right. 3 states that a mechanical cell can exist in. Myocyte. The first state is called polarized. What's that mean? The cell has a negative interior and a positive surface. Even though potassium is the biggest intracellular electrolyte, and sodium is the major extracellular electrolyte, and potassium is positive, and sodium is positive, polarized state is negative interior, positive surface for the myocyte. The next state that a myocyte can exist in is depolarized. What's that mean? The cell takes on a more positive interior, more positive, and a negative exterior. That's depolarized. And what happens when it depolarizes? It contracts. It contracts. Forces the blood and oxygen around. What's the next state? Repolarized. It goes from depolarized back to resting. Negative interior, positive surface. No heart sounds. Okay? If you take a stethoscope, you listen for heart sounds, right? You're going to hear what? Usually. Everything's normal. Lub, L-U-B-B, and dub, D-U-B-B. Lub, dub, bump, 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 bump. Okay? All right. Lub is also called S, like Sierra 1, S1. And it's the first heart sound. What causes it? The slamming shut of the AV valves, the atrioventricular valves. Tricuspid on the right, bicuspid on the left. What valves are open? The semilunar valves. They call them semi, half, lunar. They look like moon. If you go off your Prozac for about a week, don't do this without adult supervision. You keep looking at the semilunar valve, the pulmonic on the right, the aortic on the left. They look half moon shaped. Okay, little flappers in it that look half moon shaped. Those are open. So when you get systole, the heart's contracting. See, the semilunar valves are open. Pulmonary on the right, going to the pulmonary artery that looks like a T. Aortic on the left, going to the aorta, the largest artery in the body. Okay, they're open. Blood's going through them. And then when they shut at the end of diastole, that creates a second heart sound called dub. Bump, bump, lub, dub. And dub has been referred to as S2. S2. So lub, S1, first heart sound, slamming shut of the AV valves, tricuspid and bicuspid. Dub, S2, slamming shut of the pulmonic and aortic valves, the semilunar valves. I'm looking. All right. Now there are adventitious heart sounds. They're called an S3 and S4, but for the purposes of this course, just to let you know you hear heart sounds and what they're called. Now, so S3 and S4 would be abnormal. And we call that adventitious. If we're not sure, if you don't know whether it's an S3 or an S4, you can just say adventitious sounds. Okay. Now, I want you to know your intervals. Very important. PR, Papa Romeo, PR interval. What is that? From the beginning of the P to the beginning of the R. Let's put that another way. From the beginning of atrial depolarization and contraction to the beginning of ventricular depolarization. What should it be? 3 little blocks through 5 little blocks wide. 0.12 to 0.20. Remember, each little block, 0.04 seconds. So the PR should be 0.12 to 0.20. Why should you know it? It can help you identify an abnormal rhythm. It can help. The QRS, 0.10 or less. 2.5 little blocks or less. The QRS. Okay. When the QRS hits 0.12, you've gone over the boundary. Not that big of a deal, but it can be. Okay. It can also, by knowing the QRS, help you identify an abnormal rhythm. I want you to look at morphology of the P's. What's that mean? How their shape, their size, their direction. They should be upright and lead to, and they should all look similar. Why, if they all look similar, guess what? All look the same is another way to say that. They're all coming from the same site. The QT interval. QT. Beginning of the Q, all the way to the end of the T. Okay. Where should that be? That should be less than half the R to R interval. Know what the P wave represents. Atrial depolarization and subsequent contraction. Know what the QRS represents. Ventricular depolarization and contraction. Know what the ST segment, right after the QRS, a little flat piece of baseline, should be flat. If it's above the baseline, also called isoelectric line, it's an elevated ST segment. If it's below, it's a depressed ST segment. The ST segment and the T wave shows ventricular repolarization. I'm looking because I want to make sure I cover most of the stuff. I'm not answering questions. I'm just giving you general ideas here, and I'm not telling you questions. Okay, horizontal axis on an EKG. Look at an EKG, look at a strip. It's a measurement of time. Time. On a vertical axis, up and down, it's a measurement of amplitude or voltage. Amplitude or voltage is the height or depth of a wave. If the ST segment is elevated, it can go up to 10 millimeters. Remember, each little block is 1 millimeter high and 1 millimeter wide. But if I'd say how tall or how deep a wave is, I would measure it in millimeters, also called amplitude. By the way, just so I don't forget, 10 little blocks high, when you're calibrating your EKG machine, your electrocardiograph, that's a machine, but don't say that. Nobody knows what you're talking about. Or the EKG machine. Okay? The electrocardiograph needs to be calibrated at the beginning. What are some things you do? You got a little knob, yeah, on the machine. It puts a line down the center of the strip. What's that mean? Well, it's not going to be way up at the top or way up at the bottom. You're going to be able to see it, hopefully. Okay. The amplitude or depression of waves. When you push a button that says calibrate or standardize, it goes up 10 little blocks like this, goes over, looks like a Lincoln top hat, and comes down. That's a standardization mark. That represents 10 millivolts. We want to make sure the EKG is standardized. And I'm looking. Know the electrical conduction system. Because the myocyte, the mechanical cell, is one big cell, one important cell in the heart. But then there's the electrical cells. The mechanical cell is not going to do anything unless it gets an electrical stimulus. Remember? Biology teacher? Frog leg hanging from a pole? What's it doing? Nothing. It's polarized and ain't doing anything. It's resting. Takes a little pin out of his pocket, touches a nerve, it jumps. What's that mean? It depolarizes, it contracts. So we have electrical cells on one side and mechanical cells on the other. The electrical cells, ladies and gentlemen, stimulate the mechanical cells to contract. But know where all this starts. Where does it start? Posterior wall, right atrium. What do you got? Sinoatrial node. You got a group of Energizer batteries. Okay. In the posterior wall of the right atrium, what do? Their whole life, they give off electrical impulses. Somewhere between 60 to 100 of them per minute. Know what that's like? That's like filling up your bathtub, dropping a pebble in the water. What do? You get these little rings that come out. They start small and they get bigger. Those are progressive waves of positive charges. So the sinoatrial node, also called the SA node, also called the pacemaker, the king of sting, whatever you want to say, is where all the electrical impulses normally originate. And the SA node gives them off at 60 to 100 per minute. You're working out, it climbs up above 100, tachycardia. If you're resting, it may go down, bradycardia. Brady means slow. Cardia, heart. Tachy means fast. Know who experimented with this at the beginning? And it took a magnet, got bored on a Friday night, drilled a couple of holes through the top of a large permanent magnet, suspended a silver wire, hooked it up to a patient, and guess what happened? The wire began to jump. And then got real creative, took a light, shined it on the silver wire, and figures showed up on the wall over and over, a repeat of the same figures, which you would know as a P, Q, R, S, and T. So the SA node, posterior wall of the right atrium, play like my fist is the SA node. Okay. And then under the SA node, we have another node. Why? Because the SA node sends out electrical impulses to what? To the atrium. To what? To depolarize and contract. How fast? 60 to 100 per minute. Because another thing that you can identify a rhythm strip is rate. And under the SA node, we got another little, kind of like a ball of yarn here. What's that called? AV node, atrioventricular. It sticks its head up there. The AV node is the only gateway to the ventricle. So when the SA node fires, like small little rings that get bigger, positive charges, it sends positive charges out to the atrium. Remember, from the right atrium to the left atrium, there's like a little wire, a neural pathway, called Bachmann's bundle that carries it from the SA node in the right atrium over to the left atrium. And then, between the SA node and the AV node, we've got three more little wires. What are those called? Inter, meaning between, nodal pathways. One is called anterior, middle, and posterior. Anterior, middle, and posterior internodal pathways. What do those do? Those carry the electrical charge from the SA node to the AV node. Under the AV node, we got this little neck like sticking up. What that's called? The bundle of His. H-I-S. Sorry, ladies, there's no bundle of His. Bundle of His. So the electrical charge goes from the SA node, and the very top of the SA node doesn't conduct electricity very well at all. Doesn't conduct electrical charges. But the rest of it, of the SA node, does. It's filled with little fibers called Purkinje fibers. Okay? So it goes down the SA node to the bundle of His, which also has Purkinje fibers, to the bundle branches, like branches of a tree, right? To the right bundle branch and the left bundle branch. And the bundle branches terminate in Purkinje, P-U-R-K-I-N-J-E, Purkinje fibers. And where are those mostly? In the ventricles, mostly. Okay. Know those electrical conduction pathways. Very important. Now, another thing I want to bring up, and I've told you this, a lot of times, the SA node is the taskmaster. It's the slave. Everybody listens to it when it talks. And the SA node says to all of the other pacemakers, keep quiet, I'm in charge. The big word, overdrive, suppress. The SA node overdrive suppresses backups to the SA node. And those backups usually keep quiet. Why? Because the SA node's in charge. Why? Because the SA node can drive faster than any backup. So it says, everybody else, keep quiet. I'm giving the marching orders for the heart. Overdrive suppression. But what if the SA node fails? You got three redundancy backups. In the atrium, like little grains of sand, are atrial ectopic foci. What's ectopic mean? Occurring in a place other than normal. Why did we say that? Because the SA node is the normal. If the pacemaker of the heart occurs in an atrial ectopic focus as a backup to the SA node, at what rate? 60 to 80. It can take over pacing. But what if you're having a real bad day here in Disneyland and the SA node fails and the atrial ectopic fails? Junctional. Like little grains of sand in the AV junction, any one of those areas can fire as a backup between 40 to 60 beats per minute and take over as pacemaker. But what if it's just a really terrible day? And the SA fails, an atrial ectopic focus just an area, fails. A junctional ectopic focus fails. You got one more chance here, ventricular ectopic focus. They can pace the heart between 20 to 40 beats per minute and take over as pacemaker of the heart. But up until that time, the SA node's in charge. It overdrives, suppresses everything else. Now, if the SA fails, like I told you, an atrial can take over, but when the atrial takes over, guess what? It overdrives, suppresses all the other pacemakers. Why? Because it can drive the fastest. It can drive faster than them. Now, sometimes, if a focus or a pacemaker backups fail, okay, and they can pace, say, atrial 60 to 80, it overdrives, suppresses junctional. It overdrives, suppresses ventricular, atrial, ectopic focus. Junctional, right? 40 to 60, overdrive, suppresses ventricular. Ventricular, 20 to 40. Now, but can the 20 to 40 in the ventricles, can you go from 40 up to 100 a little bit faster if you needed to? Yeah. You know what that's called? Accelerated ventricular rhythm. IVR. Accelerated ventricular rhythm. How about junctional? Can the junctional go above 60 up to 100? Yeah. What's that called? Accelerated junctional rhythm. And by the way, the guy that did the magnet on a Friday night with no date or whatever, just got bored, started experimenting around his house, was called Einthoven. Einthoven. Know how many leads there are totally. And this is where people go a little bit off the cliff here. They get confused. Why? Because there's only 10 leads. But we're running a 12 lead EKG. What does that mean? The electrocardiograph, the machine, changes angles interiorly to look at the electrical activity of the heart. And there's 6 limb leads in order. Lead 1, lead 2, lead 3. AVR, augmented voltage right arm. AVL, augmented voltage left arm. AVF, augmented voltage foot. And we only put the AVF on the left foot. We put an electrode on the right foot, but guess what? That's just to stabilize the tracing. Okay? Your limb leads. Lead 1, 2, 3, AVR, AVL, AVF in that order. And then you've got your chest leads, V1 through V6. Now, if I point to a wave, like a P wave, you go, yeah, it's a P wave. Or I point to an R, you go, yeah, that's an R. Or I point to an S, you go, yeah, that's an S. But let me get a little bit more complicated here. Okay. A Q wave is the first downward complex, downward and upward complex of a QRS. And R is an upward complex. So the Q, first downward complex, an R, an upward complex. But Q's come before the R, and S's follow the R. But what if you didn't have an R? You go, what do you mean? What if you just saw this, a downward and upward wave? And we don't have an R. So we don't know whether it comes before the R or after the R. Guess what? We call it a QS wave. Okay, so know your waves. If I point to a wave, go, yeah, that's this wave. That's an R wave, or that's an S wave. Now, there's something called the plateau phase, and it's represented by the ST segment. So if you're talking about repolarization, ventricular repolarization, the ST segment, right? After the S and before the T is called the plateau phase. Just coming up, when it flattens out, you got the plateau phase. The plateau phase is what? Of what? Ventricular repolarization. And the T wave, T as in Tom, represents the rapid phase of ventricular repolarization. If I say, hey, you're looking at a lead 2. Lead 2, right arm is negative, left foot is positive. Okay? Right arm is negative, left foot is positive. Know the leads in order, and know what plane, P-L-A-N-E, the leads are taken on. For instance, if we're talking about limb leads, they're taken on a plane called the frontal meaning front, or coronal plane. A plane is an imaginary flat field. The frontal or coronal plane comes in from the side. It goes all the way through the body on the other side and divides it into front, anterior, and rear posterior sections. That's a plane. Encircling the plane, okay, is like a camera, okay, taking pictures of what? The heart's electrical activity. Frontal or coronal. Then there's what? There's a plane that looks like this. Flat. Notice how I got it. I don't have it vertical, I have it flat. It comes in and it divides something into top, superior, and bottom inferior portions. That's a transverse plane. And those are the chest leads. Limb leads, frontal plane. Chest leads, transverse or horizontal plane. Know what picture the EKG camera is taking. For instance, if I run V1, which are chest leads, to V4, that's the front part of the heart, anterior. If I run 2, 3, and AVF, lead 2, lead 3, and AVF, that's the bottom part of the heart. That's inferior. If I run 1, AVL, V5, and V6, that's lateral, left lateral. That's the side of the heart. Know where V1 and V2 are. Know where V5 and V6 are. Know where V3 and V4 are. Now V1 and V2, theoretically, are over the right side of the heart. They're the right chest leads. V5 and V6 are over the left side of the heart. So is 1 and AVL too, but I'm just doing the V leads here. Know about your nervous system. Nervous system, what's the main title here? CNS, Central Nervous System. What is it? The brain and the spinal cord. Thought, intellect, memory, muscle movement. Okay. What's the next part of the nervous system? You got your central nervous system, your brain, and your spinal cord. And then you have your peripheral nervous system. 12 pairs of cranial nerves, 31 pairs of spinal nerves. That's peripheral. What does that do? Well, your brain is behind bone. So is your spinal cord behind bone. So we need a little plug and play. We need some wires to hook up the brain and the spinal cord to the rest of the body. Off of the base of the brain are 12 pairs, 24 in all, of cranial nerves. This is part of your peripheral nervous system. Off of the spinal cord are spinal nerves. So the nervous system, central nervous system, brain and spinal cord. Peripheral nervous system, 31 pairs of spinal nerves, 64 in all. 62, sorry, can't add this morning. And 12 pairs of cranial nerves. What does the peripheral nervous system do? Plug in the brain and the spinal cord to the rest of the body. All right. I'm looking. The peripheral nervous system is further subdivided. It's divided into sympathetic and parasympathetic. Sympathetic is like your gas pedal in your car. When the sympathetic nervous system kicks in, things begin to accelerate. Okay. And then you have your parasympathetic nervous system. When your parasympathetic kicks in, things begin to slow down. Parasympathetic is like brakes. Things begin to slow. So your peripheral nervous system is 12 pairs of cranial nerves, 31 pairs of spinal nerves. And you also have, right under that, you also have your autonomic nervous system. Autonomic. Autonomic just runs things when you're not conscious of it. Your heart rate, enzymes coming out of organs. Hopefully you're not thinking about that. All right. And somatic. Somatic is primarily muscle control. Soma, body. Somatic runs muscles. You take your spoon, dip it in some Cheerios, bring them up to your mouth, start crunching them. That's all somatic. So peripheral nervous system, further subdivided, somatic on one side, autonomic on the other. Somatic, muscle movement. Autonomic, it's running, like your heart rate, your respirations, all that kind of good stuff, but you're not consciously thinking about it. Autonomic, further subdivided. Sympathetic and parasympathetic. Sympathetic stimulates, parasympathetic decelerates. Calms things down. Sympathetic, the biggest drug is norepinephrine in the sympathetic nervous system. It's like a couple of bottles of 5-hour energy. It gets things going, it speeds them up. Parasympathetic, acetylcholine, also called ACH. It's like brakes, it slows things down. And these two systems are counterbalancing each other all the time. All right. Know your artifact. You go artifact, remember? When you're running an EKG, you got to start looking for artifact. And you got to try to eliminate it if you can, even before you run it. Somatic tremor. Looks like an EKG with little up and down spots. Yeah. This patient's cold, man. Give him a warm blanket. And they don't know what you're going to do. You're putting a bunch of wires on, plug them into the wall. AC artifact. Looks like got an EKG, PQRST. Then you took a Sharpie, and it's very thick and pointed. Alternating current artifact. Why? Because you got a big machine in the next room, and you got your EKG thing right up against the wall with the gurney. It can pick up AC artifact. Wandering baseline. EKG doesn't run down the center strip. It looks like it's running on a roller coaster. Why? From leads being pulled too tight. Listen, that thing you put on the person, that's called an electrode. You have 10 lead wires going off each electrode. Where is all that plugged into? The electrocardiograph. SA node, know how fast it goes. Atrial, know the speed of atrial pacemaker. Automaticity pacemaker. Automaticity means automatic. Same thing with ventricular pacemaker. Know the speeds of those. In an emergency, a dire emergency, any of the backup redundancy pacemakers of the heart can start firing really fast. What rate? Paroxysmal. Paroxysmal means sudden. So you can get paroxysmal tach of any of the pacemakers. What speed? 150 to 250. You can get paroxysmal flutter, like atrial flutter, back-to-back waves, sawtooth, yeah. 250 to 350 is flutter. Paroxysmal fib, sudden fib, 350 to 450. Now, kind of changed just a little bit with each book, but that's out of one of the main textbooks I'm giving you that from. Now, if you're looking at the morphology of a wave, can that help you identify a rhythm, where it comes from? Yes. Yep. Or the absence of a wave, that can help you too. What if I get a QRS, it's narrow, right? But no P wave. And it's somewhere between 40 to 60. What is that? Junctional. Junctional can be no P wave, or it can be inverted P waves. Why? Because everything else has failed. Almost. The SA node has failed, atrial ectopic focus has failed. Now we're down to the AV junction as a backup. And junctional can be no P waves or inverted P waves, upside down P waves. The upside down P waves can be before the QRS, buried within the QRS, or after the QRS. So if you start noticing inverted P waves, that's because of a little $2 word called retrograde stimulation. Retrograde, meaning in the opposite direction. How do things go when you got the SA node here and the AV node here and, the internodal pathways and the bundle branches? They move downward and to the left. What does? The positive charges. Downward and to the left. The direction of the positive charges is called axis. They've got a little pointer where axis is moving. What are we saying with the positive charges? The direction the depolarization is moving is called axis. It is represented by a little pointer called a vector, V-E-C-T-O-R. What if you have wide, deep, tall QRSs at 20 to 40? My guess, probably ventricular. Okay. What if you have inverted T as in Tom waves? Well, my guess, ischemia. I'm going to hold that for a second. Just, I'm having a little brain damage this morning, but that's okay. Just hold that thought for a second. All right. Guys, I'm going to stop right now because I've got 1 hour and 5 minutes here. This is your first part of helping you identify things that may be on the midterm.